Hello guys, welcome back to the channel. Malik Helps. This is the part 2 for Obstetrics and Gynae. So let's start wherever we left off without wasting any time. Let's go next to the placenta and uterus. So first patient is a 20-year-old patient. 36 weeks of the pregnancy is going on, having pain in the lower abdomen and bloody vaginal discharge. General condition is good, BP is okay, heart rate of the fetus is okay, rhythmic, and vaginal examination shows cervix of the uterus is formed. The cervix is okay, closed. Discharge from the vagina is bloody, 200 ml per day, which is something abnormal. So a head of the fetus is located high above the minor pelvic entry. Head of the fetus is located high above the minor pelvic entry. A soft formation was defined through the anterior fornix of the vagina. So I think we have seen this question. What soft formation can be defined through the anterior fornix of the vagina? So near to the fornix of the vagina or near to the cervical opening, soft formation is placenta. We all know that this is the case of placenta previa, that the placenta is abnormally covering the cervix of the uterus or something like this. So this is the placental presentation, the case of placenta previa. Have seen the similar case before in the same video. Yeah. So next patient is 30-year-old, full-term pregnancy, severe pain in the uterus 1 hour ago. So nausea and vomit, cold sweat. Anamnesis states that cesarean section 2 years ago she had. So there is already history of cesarean sections. So now what's happening is she is having severe pain. So we already suspect that the severe pain is there and the history of cesarean section is there. So we are already suspecting that the problem could occur with the previous scar of the cesarean section. Let's see what's else in the question. Uterine contraction stopped. Okay, if the uterus has ruptured, so the contraction will not occur anymore. Skin and mucous membranes are pale because of the blood loss. Heart rate is 100, which is elevated, or tachycardia. The BP is severely low because of the blood loss. Uterus has no clear margins and it is sharply painful. No fetal heartbeat can be auscultated in the fetus. So basically, if the fetal heartbeat cannot be auscultated, there is a severe pain, cesarean section history, a bloody discharge from the uterus. So we are sure here that we have to mark the uterine rupture because the previous scar would have got ruptured. So next patient is 22-year-old, gravida 1 para O. So sharply painful contractions. The contractions are very painful, occur in every 4 to 5 minutes, last up to 45 to 30 seconds. Amniotic fluid did not burst. The fetus lie in the transverse lie. Fetal heartbeats are not affected. Contraction ring is actually painful. Located obliquely at the umbilicus. So diagnosis. First of all, the fetus is in the transverse lie. You can see here how the fetus lie in the transverse lie. And since it is mentioned in the question that it is gravida 1, it means this is the first pregnancy for the woman. So when the pregnancy is the first pregnancy, so the uterus is under the highest stress because it's the first pregnancy. And sharply painful contraction, this is something related to the uterine rupture. And what else? The contraction ring is actually painful. It should be painful, yeah. During the contraction it is painful, but the question highlight that contraction ring is actually painful. It's like it is more painful than usual. So we know that pregnancy is a painful process, but contraction ring is actually painful. The question wants to scream that it is more painful than usual. So the uterus is under the high stress. So why impending uterine rupture? Why not direct uterine rupture? Because we are still missing the blood in the question. So we still don't have the bloody discharge in the question yet. That's why it is impending uterine rupture. So as soon as we will see blood in as a discharge or in the question, Then we are going to mark uterine rupture. Right now we are just missing the blood in the question, so we will mark the impending uterine rupture. Let's go to the next patient. Next patient is having 40 weeks of pregnancy. Fetal is in the longitudinal line, cephalic presentation, pelvic size is this and this, weight is this, labor contraction lasting for 12 hours. Labor is too much, is lasting for 2 hours. Within the last 2 hours, there were extremely painful contractions. The woman is anxious. Water broke 4 hours ago. So the contraction ring is located 2 fingers width above the navel. Henkel Western sign is positive. So the only thing which you should remember in this question is Henkel Western sign is positive. So whenever the Henkel Western sign is positive, it means impending uterine rupture, or let's say the rupture of the uterus has started already. So no need to remember anything else in the question. When there are more question over this sign, that when the Henkel, sometimes the test center write the Western sign as WASTEN. So Western or Western, both are the same. So this is Henkel Western sign. So whenever you see the Henkel Western sign, you have to mark the pathology as threatened uterine rupture. Because the uterine rupture has started, we are not sure if it is completed or if it is has occurred completely. So we just scared that when the Henkel Western sign is positive, that uterine rupture might have started. So that's why we have marked the threatened uterine rupture here. So next patient is multigravida, labor 2, 36 to 37 week. Labor water broke 8 hours ago. Labored activity continues for the last 4 hours. Regular with the contraction 35 seconds, which is a bit low. Occur in 3-4 minutes, which is good thing. Child is in the cephalic presentation, which is normal, with the head pressed to the entrance into the lesser pelvis. Sudden sharp abdominal pain. This is some finding for the sudden sharp abdominal pain. Let's see the question. Pulse is a bit high. BP is a bit low. In between these and these ranges. So it's a bit low. Uterus is tense and doesn't relax between the contractions. So the uterus doesn't relax or in between the contractions. Fetal heartbeat is 100 and muffled. Fetal heartbeat is low. Amniotic fluid is blood colored and continues to leak. So basically we have sudden severe abdominal pain. We see that that sudden severe abdominal pain is in the cases of placental abruption, or in the cases of uterine rupture there is a severe pain in the lower abdomen. So it's a bit difficult thing, but it will be easy to remember that sudden sharp abdominal pain, it means the placenta got detached. The sudden sharp pain we see in the symptom of placental abruption, that there is a sudden sharp severe abdominal pain. And also the amniotic fluid is blood colored. So the placenta basically got prematurely detached from the normal position, and that's why we see the bloody discharge continue to leak, since the placenta got detached from its normal position. So this is the case of placental abruption again. So you can read the symptoms of placental abruption again. So let's go to the next patient. Next patient says 25-year-old woman, a contraction occurring from 12 hours, last for 25 seconds. Interval between them is 3-4-7 minute. Irregular. The question itself says the contractions is irregular. The coordination of the contraction is irregular. It is not 3-4 minute. It is not 5 to 7 minute. It is 3 minute. The first contraction has occurred in 3rd minute. The second contraction occurred in the 4th minute. So the third contraction was The first contraction occurred in the 3rd minute. The second contraction occurred in the 4th minute. So the third contraction was supposed to be in the 5th minute, right? So the next contraction occurred in the 7th minute. It means the coordination between the contractions is irregular. The question also says irregular. So another thing are there which is sharply painful, pain spreading upwards, a lot of things are there, you can read them. Main thing about to highlight is that the labor activity is discoordinated, it is not coordinated. The next expected contraction was on the should be on the 5th minute, but it is on the 7th minute now, so it is the discoordinated labor activity. Next is peritonitis. This is peritonitis is inflammation of peritoneum, which is a thin layer of tissues that lines the inner wall of the abdomen and covers the most of the abdominal organs. So if there is any inflammation in the peritoneum layer, so the symptoms which we will see is a severe abdominal pain, tenderness, distended abdomen, fever, nausea, vomiting, rapid heart rate, decreased urine output, inability to pass the gas or stool, and many more things which we will see in the question directly. So first patient is a woman having fever, sharp pain in the lower abdomen, sanguinopurulent discharges, which means blood and pus together, discharge from her genital tract, 6 days ago underwent illegal abortion. So most of the time the pelvic peritonitis occurs after the induced abortion. Let's see the CBC changes. The BP is low, the pulse is high, the abdominal rigidity, rebound tenderness. This is Bloomberg sign, or let's say the sign of one of the signs of peritoneal irritation. So if the sign there is a sign of peritoneal irritation, so we'll see painful palpation on the lower abdomen. Lower abdomen is painful. Uterus is enlarged up to 7 weeks of pregnancy. Painful. Posterior vaginal fornix overhangs. So please don't mark in the apoplexy in this question. We got what we needed for the question. This is a Bloomberg sign. Rebound tenderness is there. So there is a risk for the peritonitis. So we mark the answer pelvic peritonitis. Next is on the 4th day after the cesarean section. So these questions are related to like this, that some patient had any abortion, some patient had some sort of cesarean section. After 4th day after the cesarean section, a woman got fever, abdominal pain, pulse is high, vomited twice, sluggish, tongue is dry, has a gray coating, abdomen is distended. Signs of peritoneal irritation are positive in all segments. So this is the hallmark key point for the question, that signs of peritoneal irritation are positive in all the segments. So this is something known as the diffused peritonitis. Other things will be similar or same, like peristalsis can't be auscultated, no passage of gas or stool occurs. Uterine fundus is located at the navel. Uterine is painful or palpation, and discharge is moderate, which contains the blood and pus. So when the signs of peritoneal irritation are positive in the all the area or all the segments, so in such questions we are going to mark the diffuse peritonitis, or this is the profile for showing the diffuse peritonitis. Next is spread peritonitis. So a 29-year-old patient after the labor vomited, severe pain in the lower abdomen, retention of stool and gas. So the passage of stool and gas is not occurring on the 3rd day after the C-section. This question also says about the C-section history, or let's say another history is abortion. So general condition is difficult, skin is pale, lips and tongue are dry, she is having high fever, abdomen is distended, sign of peritoneal infiltration, peritoneal irritation are positive throughout the abdomen. So if in the last question we see that sign of peritoneal irritation were positive in all segments. So the segment which is talking about the pain was in the lower abdomen, so it was talking about the all segments. So this question is talking about the throughout abdomen, like it has been spreaded to the all the abdomen, so that's why spread peritonitis. What it says is intestinal peristalsis is weakened, oliguria, uterus is large, painful during palpation, unpleasant smell of discharges from the vagina. So main thing to highlight over this is when signs of peritoneal irritation are positive in all the segments. So in that question you have to mark the diffuse peritonitis. When it says that the sign of peritoneal irritation are positive throughout the abdomen, like the whole abdomen is involved. In the last question they didn't say that the whole abdomen is involved, that's why it was the diffuse peritonitis. In this question they say that the whole abdomen is involved, that's why it is the spread. Let's see next thing, the acute metritis or metriosis. This is something, first of all there will be the history is given, like C-section or any abortion will be given. So in such questions, first of all what happens is that after the induced abortion or C-section, what happens is, first of all the endometrial layer start to get infected, and then the myometrium layer start to get affected. So let's hear to the patient. The 25-year-old patient has been hospitalized in the gyno department with the complaints of fever, pain in the lower abdomen, purulent discharges from the vagina. She became acutely ill with 1 week after the artificial abortion. Objectively the following is observed: pulse is high, BP is low, soft abdomen, painful on palpation in the lower segment. So a gyno examination detected the following: the uterus is enlarged, soft, painful, appendages are unchanged, the vaginal fornix is free, discharges from the vagina is profuse and purulent. What is the most likely diagnosis? So most of the friends are marking pelvic peritonitis. So they did not given any sign of the peritoneal irritation, so we are not going to mark pelvic peritonitis for this. The other things you can read the option by yourself, other things doesn't make sense and no sense at all. So mark the acute metroendometritis, because the patient had an artificial abortion and no signs of peritoneal irritation is given. So what we expect is, first the endometrial layer would have got infected, since we know that the endometriosis is not really painful, so no one noticed it, no one cared about it until the problem has progressed until the myometrium layer. So mark for this the acute metroendometriosis. One more case is there, a similar case, 25-year-old complaint, are the same. So they are different. So a 25-year-old woman complains of fever, 37, pain in her lower abdomen, vaginal discharge 3 days ago. At 10 weeks of pregnancy, an artificial abortion is performed. Objectively the cervix is clean, the uterus is slightly enlarged and painful, the uterine appendages cannot be detected, fornices are deep and painful, sanguinopurulent discharges, which is blood and pus, is being produced from the vagina. So make the diagnosis. So first of all they had an abortion. The main key main key highlight here is the abortion. So it will progress as a post-abortal metroendometriosis. So pelvic peritonitis, I myself marked it wrong. So pelvic peritonitis, why not? Because there is no sign given related to the pelvic peritonitis, so we are not going to mark the pelvic peritonitis. Other things will not make sense in this question as well. The only thing which will make sense is post-abortal metroendometritis. So this is it with this video. The video is not really long. It is the shortest explanation of obstetrics and gynecology, whichever could be made. So I hope you will watch it again. If you will watch it once again, you will not mark anything incorrect. You can watch it on 2x speed as well. So wait for the next video. More content is loading. Have a good night. See you.